Hey, this is Dr. Green with Momenta Chiropractic, and today we're going to talk a little bit about back pain and the baseball swing. So when we see baseball players in the office and they end up having back pain, especially towards the end of their swing or after having like batting practice or tee drills and start developing back pain, usually the first thing that we're going to look at is what their hips are doing through their swing. So one of the most common kind of hitting characteristics that we see with the development of back pain specifically from hitting is action at the hips in terms of kind of standing up a little bit too early, letting their hips come forward and getting a lot of rotation through their back instead of in their hips. What I mean by that is when we're in our batting stance, right, and we're going to swing, what we want to look for is for those hips to kind of stay on this line. So if you were to think about like an imaginary line of where my hips are, right, on this kind of plane here, what we want to see is rather than coming forward and then having that hip come off the line and stand up, we want to see the hips stay pretty much on that line or behind that line as we swing to make sure that we're not getting too much rotation through the back, okay? So what that looks like is being able to step, transfer weight to the front foot and allow the rotation to come through the hips, keeping the hips back and then rotating through versus stepping, letting the hips come forward and then getting all of that rotation through my back, which ends up putting a ton of pressure through here. So in these cases, we like to do a drill using a band, which I'll show you now, that helps to kind of get the right patterning of things rotating in the right places and tension through the right places in the core to keep things out of the back during the swing. So what we're going to do is take this band, we're going to get into that same kind of batting stance, right? We're going to take a little bit of a step, making sure that the hands stay back. We're going to transfer weight to that front foot and start to rotate the hips through, making sure to keep our hips back and not stand up, okay? So step one, right, weight forward, transfer weight to the front foot, rotate the hips, keep hips back, and then we're going to bring the arms through to be able to feel that same line of tension coming through the core, not the back. What you'll notice with this is if we have players that take that step and then stand up and begin to rotate, that tension leaves the core and it starts to go into the low back because we're using some of those spinal erectors to start to rotate a little bit too much. If we do that over and over again, we're going to start to develop pain. So this drill of being able to keep hips back, rotate through the hips, and then drive the hands down can help to keep tension in the right places to be able to keep rotation happening through the hips and transfer that force through the core and then through the bat to be able to kind of fix that pattern and take some stress off the back. So I hope that's helpful. Give that drill a try if you've been experiencing back pain with the swing. And if you have any questions, feel free to let us know.